Welcome to this explainer. Today, we're looking at what has to be one of the most fascinating procedures in modern aesthetics. I mean, what if I told you that the absolute secret to youthful, glowing, structurally sound skin requires you to intentionally damage it? And not only that, but willingly pay someone to repeatedly stab your face. It sounds like a total paradox, right? Well, today we are unpacking the real science behind microneedling, a procedure that perfectly proves how sometimes you literally have to break something down to build it back stronger. So here is our quick roadmap for today. We're going to cover the root of skin aging, the microneedling solution, the wound healing cascade, devices and needle depths, and finally, applications and best practices. All right, let's jump straight into Section 1, the root of skin aging. To figure out how to fix the skin, we really need to understand why it ages in the first place. And it's basically a two-front war. On one side, we have intrinsic aging. This is your biological clock, your genetics, hormonal changes, and the natural slowdown or senescence of your fibroblasts. Those are the little cellular factories that make your collagen. But then, on the other side, we have extrinsic aging. This is all the environmental damage we accumulate over the years from UV radiation, smoking, pollution, and chronic inflammation. Both of these forces conspire together to basically rob our skin of its underlying structural integrity. Now, understanding the skin's anatomy is absolutely crucial here. You've got that top layer, the epidermis. Think of it as your outer shield, made mostly of keratinocytes. But look just below that into the dermis. This is where the real magic happens. The dermis houses your collagen, your elastin, your fibroblasts, and your blood vessels. So all that intrinsic and extrinsic aging we just talked about, it actually results in a thinner dermis with way less collagen and elastin. That's what gives us wrinkles, larger pores, and sagging skin. The ultimate goal of any true skin rejuvenation is to target that deeper dermal layer, to rebuild the collagen, but, and here's the kicker, without destroying your protective epidermis on top. Which brings us to Section 2, the microneedling solution. In the medical world, microneedling is formally known as collagen induction therapy, and by definition, it's a minimally invasive procedure that uses fine, sterile needles to create thousands of microscopic injuries in the skin. The absolute key word here is controlled. We are safely bypassing that protective epidermal shield and creating tiny microchannels straight down into the dermis. Why? To completely trick the body into triggering a massive inflammatory healing response. By initiating this deliberate microtrauma, the body hits the panic button and jumps straight into repair mode. And the macroscopic results from this microscopic damage are honestly phenomenal. We're talking increased collagen and elastin, vastly improved skin texture and firmness, and a very visible reduction in both scars and wrinkles. But how exactly does stabbing your skin with tiny needles actually lead to such beautiful structural remodeling? Let's look under the hood in Section 3, the wound healing cascade. Chronologically, this controlled injury kicks off this incredible three-phase biological cascade. Phase 1 is inflammation. This lasts from a few hours to a few days. Platelets get activated and cytokines flood the area. This seamlessly transitions into Phase 2, proliferation, which takes days to weeks. This is where fibroblasts migrate to the injury site, new collagen starts forming, and angiogenesis happens, which is just a fancy word for the creation of new blood vessels. Finally, we hit Phase 3, remodeling. This stretches from weeks to literally months. This is where all that new collagen matures, elastin gets produced, and a brand new, stronger dermis is forged. Now, driving this entire three-step cascade is a super powerful cocktail of growth factors that get released during that first inflammatory phase. You have PDGF and TGF-beta driving cell division. You've got VGF, which is critical for building those new blood vessels. Throw in some FGF to boost your fibroblasts, and EGF to make sure the protective epidermal layer heals up quickly. These chemical messengers are basically the directors on set, yelling at your fibroblasts to wake up and start building new structural proteins. So how do we practically make this happen? Let's get into Section 4, devices and needle depths. You've probably seen these two tools before. On one side, we have the traditional derma roller. It uses fixed needles, it's super affordable, and you'll often see people using it at home. But because it rolls across the skin, the needles actually enter and exit at an angle. That can sometimes cause a bit of erratic tearing. On the other side, we have the derma pen. This is a motorized device you'll mostly see used by trained professionals in a clinic. It stamps the skin perfectly vertically, so it's much less traumatic. Plus, the practitioner can adjust the needle depth on the fly right in the middle of a treatment. And there's also a really advanced variation of this called radiofrequency microneedling. This takes that mechanical injury from the needles and adds thermal injury, literally delivering precise heat straight into the dermis. It's a double whammy that gives you amplified benefits, especially if you're trying to tackle stubborn acne scars or you really want that enhanced skin tightening effect. Now, you really need to grasp that needle depth is everything here. It completely dictates what issue you're fixing. A shallow depth of just 0.25 millimeters, that doesn't even reach the dermis. It's basically just used to help your expensive serums absorb better. Moving to 0.5 millimeters targets fine lines and pigmentation. At 1.0 millimeter, okay, now we're seeing true collagen stimulation. For tough issues like deep acne scars, a practitioner will dial it up to 1.5. And for really deep scars or thicker skin on the body, they might even go down to a full 2.0 millimeters. It's a highly customizable procedure. Okay, let's wrap this up with Section 5, Applications and Best Practices. What does the data actually say? Well, the clinical data backs microneedling for a surprisingly massive range of issues. Beyond the usual acne scars, surgical scars, and fine wrinkles, it is highly effective for enlarged pores and stretch marks. It has to be used carefully with melasma, but here's a wild one. It's incredibly effective for treating alopecia or hair loss. Those micro-injuries crank up VEGF and stem cell activity, which dramatically enhances the absorption of topical hair loss treatments like minoxidil. And speaking of topicals, because microneedling essentially opens up thousands of tiny doors straight into your dermis, it is the ultimate delivery system. Practitioners will often apply vitamin C, hyaluronic acid, platelet-rich plasma, tranexamic acid, or even cutting-edge stuff like exosomes right during the procedure. But listen, here is the absolutely critical caveat. Because those channels are wide open, the sourcing of those topicals is everything. Practitioners have to use incredibly high-quality sterile products, otherwise you risk serious contamination or horrific adverse reactions from cheap ingredients. Which perfectly brings us to who should definitely not get this done. Contraindications include anyone with an active acne infection or a herpes simplex outbreak. In fact, if you're prone to cold sores, you usually need to take antivirals before a session. It should absolutely never be performed over cellulitis, open wounds, or skin cancer. And if you have poor wound healing, uncontrolled diabetes, or you're prone to forming keloid scars, you have to skip this. Your body just can't properly execute that delicate wound healing cascade we talked about earlier. But if you are a good candidate, a standard protocol is usually around 3 to 6 sessions, spaced out about 4 to 6 weeks apart. That spacing is key because it gives your skin time to get through those initial inflammatory and proliferative phases. And honestly, here's maybe the most mind-blowing fact in this entire explainer. Long after you leave the clinic from your final session, that collagen remodeling phase in your dermis continues working invisibly for up to 12 full months. Now, during the immediate 24 to 48 hours post-treatment, your skin is incredibly vulnerable. Strict aftercare is completely non-negotiable. No makeup, no heavy sweating at the gym, no swimming, no saunas, and absolutely no direct sun. You're basically sticking to a gentle cleanser, a super simple moisturizer, and heavily relying on an SPF 50+ to protect that healing epidermis. So why has this procedure completely taken over aesthetic clinics? The advantages are just too good to ignore. Unlike a lot of intense laser treatments, microneedling's incredibly safe for darker skin types because it doesn't use heat that might accidentally trigger hyperpigmentation. Add in the fact that it has minimal downtime, it's cost-effective, easily repeatable, and, as we've seen, it's incredibly versatile. By the way, all the clinical insights mapping out this complex relationship between aesthetic treatments and biological healing today comes straight from the evidence-based health optimization research over at Arbor Vitality. Which leaves us with a pretty fascinating final thought to ponder. We've just seen how effectively we can trick our skin into this massive rejuvenation just by causing a tiny controlled crisis. So, if a little controlled injury can unlock such powerful, long-lasting dermal repair, what other natural, latent healing cascades is the human body hiding? What else is just waiting for us to harness and optimize? Think about it. Thanks so much for joining me for this explainer, and I'll catch you next time. Keep learning.